To today's press conference. This is Veterans Lobby Day. We are proud to be here with veterans and veterans' families from across the state of Texas, advocating for passage of House Bill 3857, which is the state's first comprehensive medical marijuana legislation. House Bill 3785 will bring about the state's first comprehensive medical marijuana legislation. We are thrilled at this historic moment in Texas. This is the first time in Texas history that a comprehensive medical marijuana bill has been introduced. And the qualifying conditions for this tightly regulated program include PTSD, traumatic brain injury, and severe chronic pain. And those are three of the issues that are most important to the people who are standing here behind us today, veterans living here in Texas and their families. We are thrilled to have the support and the championship of Representative Marisa Marquez from El Paso. She has introduced and sponsored this bill in the House and is fighting hard to move this bill through the Public Health Committee. Today, our ask is for a hearing in the Public Health Committee in the House and for a vote to happen on the same day as the hearing. It is a critical moment in session, and we have the support that we need to move this bill to the next stages of the legislative process. Today, veterans from around the state will visit with their representatives and their senators, talking about their personal experience and why this issue is so critical to them. Over 1.67 million veterans live here in Texas. Unfortunately, many choose to leave the state and become medical refugees in states where they're able to safely and legally access medical marijuana treatment. This has to end this session. We need to keep our veterans at home once they return from service. Today, I'd like to introduce a few of our veteran leaders who have been critically important in bringing us to this stage in the process. First up, to talk about his experience and the critical necessity of bringing medical marijuana to Texas now is Tristan Tucker. He is a resident of Denton, Texas, a student of political science, and a retired Navy veteran who's here to talk about why the veteran community needs access to medical marijuana now and why passing House Bill 3785 is so critical. Tristan.
Thanks, Caitlin. Thank you to the press for being here today. We really appreciate you taking the time to come down here and help us with this very important issue. Many Texans don't realize that every day in Texas and across the country, 22 veterans commit suicide. And they take their own lives due to service-connected issues that could be mitigated or treated by the ingestion of medical cannabis. Every year, 8,030 veterans. Between the end of our session this year and the beginning of session in 2017, it'll be about 14,000 veterans who have taken their own lives. By passing this legislation, we could have helped save at least some of them. 14,000 people, 14,000 graves would be put into the ground, and we could have saved at least some of those guys by legalizing the plant. Today I'm flanked by veterans from Vietnam, from the Desert Storm, from Afghanistan, and from Iraq, who have assembled in Austin to come down here and fight for the rights of their brothers and sisters who are being mistreated, who are being forgotten, who are taking their own lives, and who really deserve a fair chance to medicate how they see fit for their own selves, to take care of their own lives and to take care of their own families. Today we're all assembled, these veterans, to call upon Representative Myra Crownover and those who sit on her committee to bring House Bill 3785 up for both a committee hearing and for an immediate vote so that we can pass this historic piece of legislation into law and we can help take care of those who are so willing to sacrifice everything for us. My name is Tristan Tucker. I'm a 90% disabled Navy veteran. It is my honor to be in front of these men and women and to fight for equality and to fight for fairness, because veterans in 23 other states are already able to receive this treatment and have already began to mitigate the losses that we see every day. Please, if you're anywhere in Texas, contact your representatives, urge for passage of this legislation, Myra Crownover, please give us a shot. These people behind me deserve it. Thank you.
Tristan spoke about the high suicide rates among veterans returning from service, 22 on average per day. In addition to self-harm and suicides, the pharmaceuticals that are often prescribed for the conditions service-related injuries are extremely harmful and lead often to overdose, to misuse, to addiction, and to all range of physical and mental side effects. This is another moment when we see the research on medical marijuana showing that it can help the service-related injuries that our veterans face every day without the harmful side effects that so many pharmaceuticals cause us. Next, I'd like to bring up Romana Harrison. She is a retired Navy veteran living here in Texas, and she's here to tell us about her story and the importance of safe and legal access to medical marijuana for veterans. Romana, please join us.
Thank you, everybody is here. And I'm happy that this bill has been introduced. I am a proud Texas veteran, 100% disabled with PTSD from 4 years of military sexual trauma. I survived beatings and rapes. When I got out, I wanted to die. I was given direct order during some of these attacks and told, in the case of an Iranian pilot who raped me, that this was national security and I was not allowed to tell anyone, including my own mother, why I could not have children. About 15 years after I got out, my uncle did an intervention on me as he watched me line up punch cups of Jack Daniels and shooting them. He told me that the day of D-Day he survived, and some French soldiers smoked cannabis with him. They told him, "This will not make today go away, but it will help you." He told me then how he used it as an exit drug from alcohol and opiates, and he begged me to do the same thing. And I followed his advice. I smoked cannabis with him, and he made me promise that whenever I wanted to commit suicide, I would stop and take a puff and see if that didn't help. And God bless him, he was 100% right. If not for the medical cannabis, I would not be here. As I said, I was well on my way of drinking myself to death. I lived in California before I relocated here. This is what we are fighting for. This is a physician's statement recommending medical cannabis to me. This is what we need here in Texas for everybody. It says that I will follow the laws, he advises me not to overdose, and he suggests that I use it in an oral manner rather than smoking it. There, I also had the chance to try CBD only. I know there are some CBD bills up only, and that will leave out almost everybody here, including Alexis Bertelli in Oregon, in Colorado, who cannot come back because cannabis is stopping her seizures, but CPS could take her away from her parents. Her parents are also veterans, and I know the dean would have liked to have been here, so I speak on his behalf as well. I pray that we get a hearing on this. It is vital. As stated, we don't have 2 years for many of us to wait. Hypothetically, some of us are medicating on our own this way, and we do not want to be criminals. We really don't. We didn't fight for our country to be criminals. So I ask and I humbly request that this bill gets a hearing and voted on the same day. Time is of the essence. Our children, our veterans, our Texan citizens don't have 2 years to wait. Thank you very much.
Thank you, Romana. More than 23 states have passed medical marijuana programs, allowing their residents to work with their physicians to get safe and legal access to the medicines that best fit their needs. Texas is a leader in many ways, including medical research, but we are lagging behind in bringing medical marijuana program here to the state. That's why we're so excited about House Bill 3785. This will produce a tightly regulated program based on successful medical marijuana programs in red states like Nevada to allow patients to work with their physicians and decide through a certification process be able to access the medicine that best fits their needs. The next person I'd like to bring up is a retired Air Forceman, Rick Womack, who's going to talk to us about medical refugees and his experience. Thank you, Rick.
Good afternoon. My name is Rick Womack. I am a proud father of 3, a disabled Texas veteran, and a former Air Force mission support officer who knows what the face of a refugee looks like. From July 5th, 1994 to March 1st, 1995, I was assigned to Joint Task Force Safe Haven, Panama in a dynamic joint interagency environment. I served as Personnel Contingency Operations Officer, Director for a 36-person in-processing team to establish absolute accountability for 54 flights arriving from Cuba, ensuring 8,678 migrants or refugees were identified and tracked throughout the operation, which included a full-on medieval riot, a couple of Tower Air 747s packed with Army Rangers toting axe handles or bats, detention camp operations, and a forced return back to Cuba. Today, the past parallels the present, as 22 veterans will kill themselves rather than endure the private riot inside themselves another day. Countless more are going to die because of overdoses, crashes, and an inability to access timely treatment from the VA. More Texas veterans are going to migrate against their will to Washington or Colorado or one of the other medical marijuana states, now comprising about half the union. Sarah Boyd is one of those veterans. She moved as a patient herself. Dean Bortel is one of those veterans. He moved his daughter. Every day that passes adds to the growing number of veterans who are forced to join what can only be described as an epic mass migration of patients and families trying to save their lives. Yesterday, Oklahoma signed the Right to Try Act into law, and here in Texas we are about to do the same in the hopes of helping terminally ill patients access experimental medication and treatment. For all the same reasons, Texas veterans have earned the right to try doctor-prescribed or recommended medical cannabis for PTSD, chronic pain, and other debilitating conditions. We must honor and remember not just those veterans who have died, but also those who will. The Texas legislature must act decisively now. Pass House Bill 3785 and give our Texas veterans the fighting chance they have already earned. Please, and thank you.
Thank you, Rick, and to all the veterans and veterans' families who are here today, who really are bravely stepping out on this issue, walking into legislators' offices to share from personal experience why this issue is so critical. Indeed, bringing medical marijuana to Texas is not a red issue or a blue issue. It's not an issue about Republicans or Democrats. It's about bringing compassionate care to patients, veterans who need it now, who need it today. We cannot wait another session for this to happen. We have folks who are suffering today and who need help today. We are here to call on Representative Crownover to give House Bill 3785 a hearing in the Public Health Committee. We're also calling on her to bring this to a vote on the day of the hearing. We know that we need to move this bill past the Public Health Committee and advance it in the process to give a real shot to the veterans here and to patients around the state to be able to access medical marijuana in the near future. Earlier today, I asked the people who were here in the room how many of them had considered leaving the state to be able to safely access the medicine that best fits their needs. I'm going to ask again, by a show of hands, how many of you have thought about leaving the state to be able to safely access the medicine that best fits your needs? And how many of you know someone who has left the state? And so I encourage the legislature to look behind me, to look at the constituents who are here fighting for this issue. We want to keep our Texans at home, and we need to bring medical marijuana to the state this session. Thank you very much for your work on this issue and for your attention. To the members of the press, many of our veterans are interested in one-on-one interviews. If you'd like to speak with any of them, feel free to find me and I can connect you, or feel free to approach anyone who is interested in speaking. Thank you very much.
Right morning when my work is over, I'll fly away home. Lord, what bright morning when my is over, I will fly away home. One bright morning when my work is over, I'll fly